Hello there, Mr. Mason. Can you hear me?
Yeah, I can hear you very well. I was starting to get a little bit anxious because I couldn't find the link.
Yeah, it was almost my fault.
But don't worry. Don't
I
worry.
hope we were able to correct this fault.
Yeah, no, it's fine. Yeah, we are connected now. Yeah. And with the previous one I had, with the address I was using before, Zoom was asking for a passcode. Now this is perfect. So you can see me well, right?
Yeah, correct.
Excellent. We are on time. We have 10 minutes.
Yeah, you can prepare and just take your time, whatever you feel fit.
I'm going to have a sip of water. I will be back in a second.
For being on the phone, actually.
Okay.
Unfortunately, my PC mic broke down, not in time.
Oh my God. I will be back in 1 second.
You did.
Yes.
tell me, Dr. Mazin, whether I should enable the presentation for you, or you'll do it yourself.
Whatever you prefer. I have the presentation here. I adjusted something about the format, not the content. The content is absolutely the same. May I show you? Let me. Could you allow me to share screen?
Excuse me, you aren't allowed? Try now.
Okay, let's just.
You can?
Yep.
Yeah.
Yeah, it's working fine.
I'm seeing it clearly as day.
Okay. Yeah, looks good.
Okay, so consider us to be ready when you are.
You
may
tell
well,
me.
I mean, you may wait like 2 or 3 more minutes, then I'll introduce you in Ukrainian language to our viewers, and then you can start.
Yeah, perfect. So a couple of minutes.
Yeah, indeed.
Okay, that's fine. The name of the city is Poltava or Poltava?
Poltava, we call it.
Poltava.
Poltava, yeah, accent on first A.
Poltava. Cool. Okay, let's go ahead.
Окей, so, шановні глядачі, зараз ви маєте змогу подивитися останній вебінар серед циклу вебінарів IMEDSCOP 2021. Презентує його доктор Рафаель Мазін, perhaps. Тема вебінару No Health Issue Stands Alone, The Concept of Syndemic, або українською, що жодна проблема не існує сама по собі. Нам будуть розповідати про концепт синдемії. Так. Презентувати будуть англійською мовою, сподіваюся, ви її добре знаєте. Якщо ні, потім я, мабуть, щось перекладу. Так. Ось. Ви можете розпочинати. You can start, I suppose?
Good day to everyone. Thank you very much to the organizers of this IMEDSCOP in Poltava. I'm delighted to address this wonderful audience of young professionals and professionals who are already in the field. I apologize for having to address you in English. I speak other languages, but certainly no Bulgarian at all. I speak just a little bit of Czech, but I don't think it's very useful. So I'm going to talk in English. If I go too fast or my accent is not clear for some reason, please wave at me, team, and or send me a message in the chat, and I would repeat whatever concept or idea I'm discussing with the group. And as Tim said, I am presenting with you or for you this concept of syndemic. Is a very new concept. It was developed in the 90s, and it describes a phenomenon that we have known for centuries and centuries. The fact that no health issue stands alone, and we have dealt with it, but we have not addressed the issue or the problem in a systemic and organized manner. In fact, the most traditional approach in health sciences, in medicine, has been based in addressing one problem at a time, and with what we call a curative reparative paradigm. When I went to medical school, for example, in the 70s, I remember there was a big stone at the entrance of the uh, school that read, "Your duty is to alleviate human pain, Hippocrates." And we were convinced that we didn't have to do anything else but that, to be at the bedside of a patient, holding her hand and alleviating symptoms and fixing problems. We were very fixed in the idea that our mandate was curative and reparative. And if the problem was curable, to cure it. And after that, to dismiss the patient. We were trained to practice a medicine that was vertical, prescriptive, in which we gave to someone who was submissive, who was patient, some type of remedy to alleviate her symptoms and to fix her problem. It's interesting that when I went to medical school, my courses were divided on the one hand by organs and systems, but when we went to the hospitals were divided by diseases. So we had a service of tuberculosis, the service of diabetes, the service of this or that. And the agencies and organizations were and still are organized by diseases. Everything is focused as one problem at the time. For example, I worked for many years in the Pan American Health Organization, which is the regional office of the World Health Organization for the Americas. And what we had inside the organization was a department of HIV, in which I spent like 30 years, a department of, or a program of tuberculosis, a program of chronic diseases, a program of viral diseases. Everything was compartmentalized in silos, separated, but we didn't see health in a systemic manner. We saw, due to the organization of the organization or the structure of the organization, as a series, a rosary of isolated problems that we had to deal with. Jokingly, I used to say that instead of being the World Health Organization, we should be the Disease Health Organization, because we didn't talk about health. We talk about diseases all the time. When the HIV epidemic started in the mid-80s, early 90s, we started noticing many things. One of the things that you are certainly familiar with is that opportunistic infections, or OI, are strongly associated with immune suppression when the person living with HIV is starting to show symptoms of decline of her immune system. And one of these things we saw is that tuberculosis that supposedly was starting to be under control in the late 80s, early 90s, the medical community said, we are overcoming tuberculosis, started going up and up and up. Tuberculosis was strongly associated to HIV infection. Why? Because tuberculosis is an opportunistic infection. But then we noticed during the conduction of several studies in the field that TB was associated with other problems like nutrition, like living conditions, people living in small households in which there was poor ventilation, and poverty in general. Incidence of TB cases was really high. And in addition to that, TB in prisons, for example, went up. HIV went up, TB went up. So at a given point, TB was something we had to deal with. In fact, before we started making antiretroviral treatments accessible to the population at large, the first thing we started doing was ensuring that people received prophylaxis against TB, lest the evolution of the HIV disease would aggravate symptoms of latent tuberculosis or facilitate the acquisition of infection. As you may know, injecting drug use is associated with transmission of HIV. And hepatitis B and hepatitis C is highly prevalent among them. So we couldn't see HIV in an isolated manner without thinking about these other infections, Hep B, Hep C. And these demanded that people who were treating people with HIV started looking at the presence of these other viral infections, because the evolution of these diseases changed in the presence of immune suppression. When the Centers for Prevention and Disease Control of the United States in the mid-90s developed a new definition of AIDS, they included cervical cancer as a marker of full-blown AIDS, because cervical cancer, or rather, human papilloma virus infection has a fast progression among HIV positive women. Like anal cancer is more common among HIV positive people in general. So we started seeing more cases of anal cancer among men who had anal cancer without protection, and women as well. And some infectious diseases became more difficult to treat, like syphilis. Syphilis is a relatively easy to treat infection in the very early stages with penicillin. But if HIV infection is present, it's not that easy. It's more complicated. And in addition to that, people with HIV were subject to stigma, to ostracism, to discrimination. And in addition to that, if they have acquired HIV as a result of their sexual practices, sexual orientation, gender identity, they were sex workers or had multiple sexual partners, or were men who had sex with men, or were transgender people, the stigma, the discrimination were even worse. So you see, the HIV epidemic showed us that we couldn't see HIV as an isolated problem that needed to be treated in an isolated manner. If we wanted to deal with HIV, we needed to think about problems like stigma, discrimination, poverty, living conditions, nutrition, TB, other infections. The problem was really complex, not so simple as it seemed to many people who were working in the field. So an epidemiologist, or rather a medical anthropologist by the name Merrill Singer, proposed a new concept, and the CDC immediately adopted it. He said, we are not facing an epidemic. We are facing a syndemic or syndemic. A syndemic because we have a constellation of issues and problems that are interacting, are aggregated, and we have clusters in a population of these problems that are contributing to the aggravation of problem and exacerbate the prognosis and the burden of disease and the excessive mortality, if you want to, due to the coexistence of these conditions and enabling factors. So the syndemics develop under health disparity. This concept is really important for young professionals. Health disparity means that people don't have, in a population, don't have the same possibilities of gaining access to health care. And when I talk about health care, I'm not talking about curative reparative services. I'm talking about preventative service. I'm talking about the possibility of living a healthy life conducive to health and well-being, which is what the World Health Organization, after all, defines as health, well-being, the concept of living life with dignity. And these health disparities are caused by poverty, by stress, individual stress, social stress, and structural violence, meaning that the environment is hostile and prevents people from gaining access to many goods and services that are important for health and well-being. I insist in the term well-being. We don't want only people without disease. We want people with dignity and good living conditions. And the syndemics or syndemics are studied by epidemiologists and medical anthropologists, not always by clinicians, because clinicians sometimes are so overwhelmed that they don't have the possibility of looking beyond the problem they see at the bedside. But
excuse me for interrupting you.
sure.
I suppose you prefer the well-being term. Yes, I heard it and I became interested in it against the usual like health status use. Sorry.
Yeah.
Exactly, well-being. It's a broad term, I suppose.
It's a broad term. If we look at the definition that the World Health Organization makes of health, they say that health is a status in which people enjoy physical, mental, and social well-being. So they have pleasure in their lives. They have satisfaction. They have enjoyment in their bodies. Their bodies are fine. Their minds are fine. Their social interactions are fine. And not only the absence of infirmity or disease is what the organization says. However, many times in medicine, in public health, we think only about the disease part. So we want to see societies free of disease. This is only one piece of the puzzle. We want to see more. We don't want to see that tuberculosis is not there. We want always also to say that poverty is reduced, that structural violence is eliminated, that people live free of stress, and that people enjoy their lives. Well-being means enjoyment. Sometimes people are tremendously scared of the word pleasure because they associate it with sexual pleasure. Well, sexual pleasure is important too, as a part of the well-being among sexually active young and adult people. But it's not the only component of the whole picture, but makes part of it. And the World Health Organization also includes sexual health as a component of well-being. You can find it in a website. So,
excuse me, so we need also to include socio-economical standpoint into the well-being.
Absolutely, absolutely, yeah. Socio-economical, it's a constellation of issues, not only the physical or mental aspects, are the emotional, the relational, the way we interact with our peers, with our environment, our conditions of living, meaning socio-economical too. Some people say that we should also include spiritual, and they talk about spiritual well-being. That's a little bit more difficult to define. What's spiritual for each people means something different. It could be religious, it could be a belief in something superior. It means probably being free of stress and feeling connected with others and something superior. So the idea is that we don't limit ourselves to the traditional vision of medicine and health. We expand our scope. Okay. So
yeah, this is inherently more correct. Yes, thanks.
And yeah, this is why it talks about at the end of the fourth bullet, it talks about that the medical anthropologists are concerned with public health, but also with community health and the effects of social conditions on health. And these social conditions include the socioeconomical, the distribution of wealth, the access to food, all these elements that you will find in the declaration of the millennium when they made the Millennium Development Goals, and now in the Sustainable Development Goals. Sometimes, not sometimes, but we can identify which are the interactions that impact in a negative manner. In other words, feed the syndemics in a synergistic manner. The syndemics, we know that they occur when a health-related problem cluster in a place or a time. We start seeing a problem growing, like happened with the COVID-19 epidemic. It started clustering among few people. Then in some cities, we saw it in China, we saw it in Italy, then in Spain, here in New York, in some cities in the United States, in Seattle. And with that, with the viral infection, some additional problems started, like the individual who occupy the Oval Office here in the United States started attacking the Chinese government for this, and people started being hostile to the Asian American community. So we started seeing a syndemic evolving. In the 90s, for example, the CDC described a syndemic they call the SAVA. SAVA is the acronym that means substance abuse, SA, violence, and AIDS, that were conditions affecting in a very disproportionate manner people living in poverty conditions in cities of the United States, especially the ethnic minorities. The HIV and AIDS became a problem in the suburbs where these poor people lived, but this epidemic was either fueled by substance abuse or accompanied by substance abuse, violence, killings, and making poor people even poorer. And when we talk about poverty, I sometimes feel a little bit allergic to talking about poverty as a causative factor of health problems because it's very abstract. I don't like when people say, oh, this is caused because people are poor. Well, define what's exactly the way in which poverty is triggering the problem. So poverty is just one facet, but people is poor because they endure social inequities or because they are poor, face social inequities. It can go both ways. People endure, especially in those places where there is poverty, police brutality, and you have witnessed this in the United States and in other parts of the world. We have here a pandemic of violence because of an absence of regulations for gun possession. You probably heard this week we had
there was shooting in Boulder, right? The town was called.
in Boulder and in two cities.
Next one, I only heard about Boulder, honestly.
No, there was another shooting. An individual started shooting it was in Georgia, very close to Atlanta. An individual started shooting people of women of Asian origin. They don't know why. His claim is that he wanted to destroy sin because these women who worked in massage parlors incited sex, and he was a deep believer in his quote unquote Christian principles. But in that incident, it was 6 people killed. In this
And
one,
10 people.
10 people. So in 1 week, we have more than 15 people killed because we don't have regulations for gun possession. And this is a big problem. This is associated to the problem of violence and racism and other root causes of violence and drug use. So we have a combination. You cannot look at any one of them in a separated manner. Some politicians claim that the common citizen has the right to possess weapons, guns and rifles, because that's protected by the Constitution, supposedly. They interpret they call it the Second Amendment. Yeah, it's the Second Amendment says that the Second Amendment was made during a time in which this country still had invasions by the former colonizers, I mean, and they didn't have an army, they didn't have a police, so they passed the Second Amendment to ensure that the common citizen could defend their house and themselves in case of an invasion of a foreign army. But we don't need that anymore. We have a police, we have an army, we have a navy, we have a Marine Corps. So I don't know why it's still needed. And people claim it's our right or what? To defend ourselves. You can dial a phone number and call the police. To hunt, we have supermarkets. If you hit an animal like a squirrel with an AK-7, you destroy it. You cannot eat that. So those are strange things, but they are associated to these problems. The mentality of these people who insist in protecting and maintaining these already obsolete regulations.
What do you think the ideal gun possession law would be? Because why am I asking this? Because, for example, here in Ukraine, I consider our police to be both corrupt and also kind of ineffective. So I wouldn't mind having a handgun myself to be able to protect myself really in the streets, but we are not allowed. We've got total regulation and fire weapons are not allowed.
Yeah, well, it's a very complicated situation because you never know what's the mental condition and the social constructs someone who has a weapon has. This is why my opinion is that if someone has to possess a weapon, should undergo some kind of investigation by the FBI and her mental conditions assessed as much as thoroughly as it can be done. There have been thousands of cases, thousands of people who see some black person passing by, like a young man who was running on the street, and a man thought that he was a thief and shoot him because it was black and looked suspicious. This cannot happen. This is ridiculous. That I can understand you try to use a weapon if someone is breaking into your house and entering there. Yeah. Or if let us say a coyote is trying to grab my little puppy, yeah, I shoot the coyote, of course. But shooting a person just because he's black or Latino, or I think that person could be dangerous, is something very questionable. You know what I mean? The problem of shootings is associated with some social representations and is structural, is not individual. It's the idea that people from different races, different ethnicities are dangerous, and we have to be always suspicious of them. Does it make sense?
Yes, sorry for post. Indeed, I understood your point. The thing is, there is a distinction between the United States of America and Ukraine, both in mentalities of the people, both in the population styles. Like, unfortunately, we don't have your institutional racism problem, for example, because there is almost no people of other races here in Ukraine historically. So, but, I mean, I'm afraid, I hope you hadn't understood me correctly. It's not, yeah. I mean, there is no problem because there is no one to blame for it. Like, we don't have, for example, people of other races wandering in the streets. If they will be, I guess, a lot of population is dumb enough to be racist.
What about homophobia and xenophobia?
It's rampant. Homophobia is rampant.
Okay.
I'll put that just from the start. Xenophobia is non-existent. I don't think many people speaking about China.
Okay. Okay. Yeah. Because we see here a lot of transgender people and gay people killed, shoot, because of homophobia. So it's not only racism, it's homophobia and transphobia too. Those are serious public health issues that make part of a syndemic. So, and this is where I'm heading now. The members of key populations or groups are affected by HIV STIs. When we look at the prevalence rate among men who have sex with men or sex workers or transgender, it's disproportionately high. Every time I go to a country, they can have prevalences which it can be considered high, around 2% in general population, but you look at men who have sex with men and it's 17% or 20%, and among transgender, 40%. Other curable or non-curable STIs are rampant among them. Many countries, let me mention one example, the country of El Salvador, because I was reading about that yesterday, conducts sentinel surveillance of syphilis only among pregnant women and men who have sex with men and sex workers. And active syphilis is tremendously high. The most important thing is that key populations endure violence, discrimination is what I'm telling you, mistreatment and emotional pain. I went to visit the country of Mexico. They told me in 1 year, 40 transgender people were shot. One of the shot and killed. And one person who was shot and died because of the lesions died in the hospital because treatment was denied. She was put in a stretcher in one corner of the emergency service, and nobody paid attention to her because they said, no, leave her. Who knows which kind of diseases this thing has. So this is not a situation we find only in Mexico. If you look at the situation in the United States, in Brazil, in Argentina, in Central America, the number of transgender and MSM killed due to these discriminatory practices is astonishing. Okay, I'm about to finish by talking about how now with COVID-19, we have a very clear example of a true syndemic. How the causes and impacts of different diseases are very, very linked to each other. They are closely intertwined, making of this COVID-19 a real syndemic. We know very clearly, and look at the left side of the transparency, we cannot talk only about the viral infection without discussing the association of these SARS-CoV-2 and non-communicable diseases like excessive body weight or excessive body mass, hypertension, type 2 diabetes, and how the evolution is different among individuals who have these pre-existing conditions. So there is an association that of the two conditions that defines a different evolution, a different prognosis, a different burden of disease, and a different profile of mortality or lethality. So we see a disproportionate burden and many vulnerabilities and social inequities. We know that here in the United States, for example, diabetes and problems with body mass are more common among certain populations, among certain ethnicities. And these ethnicities have disadvantaged living conditions. So they are more vulnerable. The possibility of accessing healthcare is reduced, and therefore the impact of the disease is more severe. We have also the adequacy of responses by governments, by managers, by media that defines the trust, the credibility, the priorities and policies. I don't know if in your country you have the problems we have here, in which the individual in charge of the executive said something, oftentimes stupid things like perhaps we should start injecting bleach in the bloodstream of people with COVID to treat the problem.
Excuse me to interrupt you. We've been having this problem you're talking about for like 30 years already, ever since the independence. So we know what we're talking about.
Yeah, and in addition to that, it was not only this type, this individual, it was the agencies. One day, the one agency said something, the other one said something different. Here we have very, very serious agencies with a big prestige, like CDC, like FDA, but unfortunately, the people leading those organizations or those centers or administrations were politically appointed. So they said whatever the monkey in charge wanted them to say. The only one that maintained more or less certain consistency was the NIH, but the expert in viral infections was deeply mistreated, Dr. Anthony Fauci, for the things he said. I know Dr. Fauci from the time of HIV, and
yes,
he's a serious professional. So what happened? That people started reacting in a dysfunctional manner. First, with fear, people were scared to death. Other people didn't believe, they didn't take any care. They said, this doesn't exist. I had in my family who don't live in here, they live in the country of Mexico, but my niece's husband said, who is a veterinary, I don't believe in that because I haven't seen anyone dying yet, until they started seeing people dying and said, oh, okay. Then we had people blaming on others, saying the Chinese are to blame. People here started breaking glasses of Chinese restaurants. And few people paid attention to reliable sources, but not too many. So we still have anti-maskers, like some stupid governors of different states. The despicable senator who recently made a press conference, and one journalist said, would you mind wearing your mask? And he said, you are very welcome to leave, because if you are scared of being exposed to my breathing particles, you don't deserve to be here. Anyway, we have xenophobia, the hatred against Chinese people, and the conspiracy theorists, people who say this was something made in a lab. The vaccines they are developing contain a chip that will be inserted in our DNA, and they want to control us, etc., etc., etc. People who write science fiction cheap stories. This is having a lot of impact on families. Members are dying. I know families that have lost 2-3 members. The financial burden, people are losing their jobs. There is employment, there is stress, but there is also a syndrome that I call, let's not talk about your opinion and ideas. In many parts of the world, people are using some bogus treatments like ivermectin. They take ivermectin, which is a drug used to treat parasites. We used it here at home for my dog to prevent infestation with Toxocaracani and to prevent scabies and tick. But people take ivermectin because they heard in the internet, in WhatsApp, in Twitter, that this works. Even worse, people are consuming chlorine dioxide, and they swear to God this is the most efficient drug ever. And they don't understand that it's a drug, or is a substance used to purify water in septic tanks, that it causes erosion of the epithelium of the esophagus and the stomach, that it produces or may produce methahemoglobinemia. But they insist that it's fabulous because a famous doctor said it in WhatsApp, in Twitter, you name it. It's unbelievable. And you cannot say anything. Even in my family, they know I'm a medical doctor, that I work for the World Health Organization, but God forbid I say anything. They go berserk, and they try to bite my jugular vein. So
yeah, I feel these problems you've named are amplified in Ukraine as well, specifically about the conspiracy theorists, about the anti-maskers. I mean, we've got almost little to no vaccines arriving in our country, and still vaccines are often thrown away because they are multi-dose, and we can only find 5 people who are willing to be vaccinated for free, and 5 other doses are being thrown away. It's really unfortunate. And then I'm a medical student, and I'm trying to talk to people about the usefulness of these vaccines.
yes,
They do not mainly cause autism, for example, or better yet, some microchips from Bill Gates.
yeah,
And they say that I'm far too young to understand the world's concepts.
It's incredible. It's incredible. Yeah, it's incredible. It seems as if they were lobotomized, and the frontal cortex was totally removed, and after that brainwashed. So they don't understand or they don't accept logical reasoning. Sometimes I don't have this problem with my siblings, with my parents, but with my cousins, I have to explain with little balls and sticks, like little kids when you are teaching them to write. What's the situation? And in spite of that, they they don't understand. They don't understand. It's people have their own representations about health and disease, and even the human body. Believe it or not, I have a cousin who goes to a person who makes it's called craniospinal therapy. She goes to have her atlas aligned. You know anatomy. Tell
Yeah,
me,
the
is it possible to align atlas? How do you access atlas?
I don't know about access point because I ain't a surgeon yet.
Yeah.
I mean, I just remember, of course, that atlas is the first spondylus. Can't remember in English.
Exactly, exactly. It's inaccessible. It's inaccessible. And under atlas is axis that has the odontoid process that articulate with atlas that you don't touch there, lest you can produce a severe lesion that hurts the medulla. So you don't touch there. But she says that she goes to have her atlas aligned. I said, be my guest. Do it if you feel fine, and let the guy make money abusing your stupidity. Okay, we have growing evidence of a sequence of infection. We are seeing more and more. I'm reading on different in different journals like the New England Journal of Medicine, etc., that many conditions are developing as a sequel of COVID infection, like neurological conditions, clotting. Interestingly, I read a paper yesterday about people who lose their sense of smelling for several months, which is terrible, terrible.
Yeah, it's disturbing at the very least.
Huh?
It's disturbing at the very least.
Yeah,
Like,
very, very disturbing. And the one of the cases was about a person who he was a sommelier in a restaurant who was in charge of smelling wines.
yeah, but that's really unfortunate.
Now, I want to put a special emphasis on this point here, which is that the services have been overwhelmed and the providers are sick because they caught the infection or are completely burned out, are absolutely exhausted. And this means that the hospitals, the clinics, the services cannot provide a good standard of care for the new patients. And the new patients continue arriving because the oligophrenics who say that masks don't protect, that vaccines don't protect, contribute to increase the burden of people who need hospital-based care. So it's like a never-ending story. It's what I showed you at the beginning, a snake biting its tail. The World Health Organization has coined a term that I loved. The term is the infodemic. We are suffering not only a pandemic, a syndemic, but also an infodemic. The flow of information is not the same we used to have before we had the internet, before we had all the applications in our cell phones that gave us access to rumors, to lies. And it's difficult to trust those sources when they are serious. And the credibility is lost and the governments change their priorities and policies, and people again get confused and move again to attitudes of xenophobia, of adopting conspiracy theories, like another idiot, the president of Brazil, who is a fascist idiot, who says that COVID is not worse than the common flu. He had the infection himself, and he said it wasn't a big deal. And he walks around without a mask, and he said, this doesn't mean anything, doesn't help at all, but Brazil is having thousands of deaths per week, and it's becoming the hottest spot in the world because of this ridiculous mentality. So people continues feeling fearful, stressed, depressed, hopelessness, hopeless, anxious, and many antisocial behaviors continued happening. So this is the sad landscape we are seeing. So what's the solution we have? We need to start thinking in a more systemic way and consider if we are dealing with a pandemic, when we are at the side of the bed of a health service user, or in a hospital. What is this? Is this a limited problem to a person? What are the needs of the person? Not only the complaint he or she is expressing, or is more complex in nature? How do address it? So I'm just showing you a problematic. We need to think about a solutionatic. What's the type of steps we need to take to deal with this complex situation? So thank you for your attention. I'm open to questions.
So I suppose we should limit the infodemics first, to limit the disinformation on the web.
Yes. Yes. Yeah. Unfortunately, when I go to the WHO website, for example, they talk about the infodemics, and I invite you to go to your searching machines and enter the concept and see how the World Health Organization addresses it. The concept, or the definition of the concept, is very accurate, but then they give like some few recommendations on how to address it, and I get lost because they are very vague. So I think that the young health professionals could think, and I would invite you, team, to work with the International Medical Students Association or organization, thinking on specific recommendations, 4, 5, 6, on how to address the infodemic as a contribution to deal with the syndemic. Maybe it would be something very useful. I would be more than happy to collaborate with you in that endeavor, because I'm afraid, I don't want to badmouth the organization I work for, but I have the impression they haven't done her assignment properly. It's rather sloppy. You there? Hi, Tim. I lost you for a sec.
Yes, sorry, some kind of connection problem. I just wanted to say that I think that perhaps limiting the misinformation on the web would be a little bit totalitarian. I think the better solution is to provide more quality in education to the children, so they develop critical thinking skills for, so just they wouldn't be affected by any of the disinformation, because they would be easily able to distinguish what is truth and what is a lie. Yes.
Absolutely. Well, this could be one recommendation in the list of specific recommendations you as an organization, as an association, can make. But it would be important to have like 4 or 5 specific recommendations. The education, the school-based education is one of them. The teaching of critical thinking is an important thing, but more needs to be done. Like, for example, one sees a lot information from a famous doctor who says this or that. Well, I think a specific recommendation is go and check who is this doctor. Does he really exist? How to filter information is something that needs to be done, because the recommendations of the World Health Organization are like 1, 3, 4, 5, 6, and be prudent. Take everything with a grain of salt. What does it mean? I understand that. I know what they mean, but for the lay reader, it doesn't mean too much. So this needs to be fleshed up and transformed into something more concrete.
Yes, and last question for me. Excuse me for taking your time. Yeah, why exactly is HIV way more spread in like poverty populations?
More what?
More spread among the poverty populations.
Well, at the beginning, HIV was more common among people of middle and upper class. Mm-hmm. We didn't see it among very, very poor people. But with the passing of the time, it started suffering a transition, an epidemic transition called pauperization. It moved from wealthier individuals to poorer people. And this happened due to several reasons. One of them was lack of access to information, insufficient school education, poverty. And poverty, I don't like the use of the term as an explanation. What poverty means, that sometimes people resort to transactional sex to obtain goods, to obtain protection. Violence is more common among them, including sexual violence. And a person who exercises sexual violence doesn't think about protection, doesn't protect the person he or she is abusing. He is abusing. Drug use is more common among
right?
But it's more common not because they are poor, but because sometimes it becomes like an anesthetic to their difficulties, to their social difficulties, and in their environment, drugs circulate more easily. Like in prisons, we think that prisons are drug-free environments. False. Drugs circulate a lot in prisons. So this is what happened. It went from middle class. Middle class were men, white men, gay white men, who when they realized, uneducated white men, who when they realized that this was a sexually transmitted infection, they started protecting themselves, adopting condom use. And we saw the problem going down in that layers of society, but then it started moving to people in the outskirts of society. Hello?
Yeah, I'm
Yeah.
here.
Yeah.
Well, thanks. Like, a really great thanks for your awesome presentation. Great thanks for the possibility to discuss with you. It was a great honor for me, firstly, and I'm looking forward to meeting you again sometime, maybe in Zoom, maybe when I'll climb up the ladder, we'll even meet in person. And
Oh,
when
that
I'll
could be fantastic.
yeah, to travel to United States.
Or
perhaps not as a tourist, but as a working health man.
and I have many foreign languages books, so maybe I can learn some Bulgarian and go and visit you.
You can see some smaller bookshelves behind me, perhaps. Yeah, I'm an avid reader as well. Yes. So,
But in addition to that, think about what I said, that perhaps we can, you could, and I will be more than glad to provide some mentorship, mentoring, I mean, on a little paper on how to address infodemics in general.
yeah, thank you very much for the provided opportunity, and I'll surely keep that in mind.
Yeah,
Once I finish my state exams.
Talk about this with Chris, and maybe we can have several authors, and we do it not only for COVID, but for different health conditions.
Yeah, for example, both AIDS and tuberculosis are still major problem in Ukraine.
I know, yeah, and drug use.
Yeah, especially like opiates drug.
Yeah, exactly.
That opiates. Yeah.
Exactly. Okay, Tim. So we will be in touch.
Yeah. Correct.
Okay.
I hope so.
The other participants could follow the discussion and enjoyed it.
Yeah, they were watching both here, and we had watchers on YouTube translation, which was simultaneously streamed.
Excellent. Okay, Chris. Tim. Okay, I leave you.
Yeah, good luck. Thanks.
Take care. We'll be in touch.
Yeah, correct. Oh.
Bye.